Having blood in your eyes is not a good symptom. As a matter of fact, if you don't take matters into account right now and you wait till things get worse, you might be seeing conditions that might not have a good return. Like, for example, a heart attack, high blood pressure, a stroke, and having the symptom of blood in your eyes could be the savior if you're taking into your own hands what needs to be done in order for this not to happen again. Why are you having bleeding in your eyes? What are some of the main reasons why you might be seeing this often? Or you seeing it once and you don't know what it is and you're researching this to solve it before it gets too late? That's what I'm going to reveal to you in this video. Blood in your eyes is often referred to in medical terms as a subconjunctival hemorrhage. This happens when a small blood vessel breaks just underneath the clear surface of your eye, the conjunctiva. It's called a conjunctiva. And you can see all that blood that has been spilling out between the clear part and the white part. This happens due to certain factors, maybe blood pressure, blood thinners, or certain situations that are triggering the rupturing of these small arteries. Now, this is not a good symptom because this could be the risk or could be a sign of something bigger that is coming in the near future if you do not solve the underlying condition. Number 1, increased blood pressure. Your eyes have very small blood vessels, very much so that these are the ones most affected by the changes in blood pressure. As a matter of fact, if you have high blood pressure or you have diabetes with a high concentration of sugar, this affects these small blood vessels and they start rupturing. They start rupturing in the outer parts, but also in the inner parts. And this is how some people might even go blind. They go blind because these small blood vessels inside their eyes are rupturing. They can't be fixed. And this change in blood pressure will also change the way your eye is functioning. Now you might say, Doctor, I do not have high blood pressure and this is not my problem. Let's just move on. Well, wait. If you have high blood pressure, it might not mean that you have high blood pressure in your entire body. It might mean that you only have a high blood pressure in your eyes. That can happen when, for example, you are engaging in activities like heavy lifting, like coughing or sneezing, or even straining during a bowel movement while you're in the bathroom. I've seen this happen a lot when people are vomiting. It happens also when people are having a very strong cough. Any of these situations can cause the rupture of these vessels in your eye and cause you to bleed. Not a good symptom. Not something that is happening for the good of your eyes, so you might want to try to control that blood pressure in order for this to stop. If you need something natural that can help you with blood circulation in your eyes overall, look for Visofar. Look for Neuroflex, which also helps with circulation in your brain and the outer areas of your eyes. And also Metathyroid and On Cardio from Fineland at finelandvitamins.com. Number 2, you might be eating something that is thinning your blood, or you might be taking some type of medication. Your eyes can bleed, yes, when you have a rupturing of an artery or a vein, but they also can bleed if you have or are taking blood thinners like aspirin or maybe warfarin or other medications that you might not be even knowing you're taking that are thinning your blood. This can happen, and this can make platelets not so effective in stopping the bleeding of certain very small rupturing of arteries that might happen anywhere in the body. And this is a problem because at some point your body can bleed to death, not through your eyes, but other parts of your system, like the digestive system, like an ulcer, like a colon, or whatever other tissue that might be experiencing a not so good clotting of the platelets that are not working properly. Now, if you're one of those people who are seeing constant blood in your eyes, you might want to check with your doctor. Maybe you're taking something that is having this effect on you, and it needs to be fixed before something worse happens. If you need something natural to improve circulation, make sure that you do not have high blood pressure or low blood pressure. You have good vitamins, good herbal extracts for your eyes and circulatory health within. Look for Visofar, spectacular supplement. On Cardio, Metathyroid, and also Bright Caps from Fineland at finelandvitamins.com. Number 3, fatigue or stress. Constant fatigue, being tired all the time, maybe at some point during the week, it doesn't really matter because your eyes strain. They get really tired, they get dry, there's not enough fluid within them. Your eyes actually, and everybody feels when they're tired, the eyes are extremely heavy. For as a matter of speaking or saying that your eyes are really tired. And the reality is that they're straining. The circulatory system within the eye is also having a hard time. There's not enough liquids flowing around to make sure that your eye is well and wet. And this obviously has an effect. It has an effect in the bleeding of your eyes. You see more stress, you see more fatigue, your eye feels all of this. And the same thing happens with stress. If you're stressed out all the time, if you're worrying about everything, you're not taking a rest, you're not sleeping well, you're not making sure you're getting that restful sleep, well, your eyes are going to feel all this and you're going to see more bleeding in your eyes. Not a good sign. You might want to take a vacation, start to leave all this stress behind, and make sure that you can rest properly in order for your eyes to make sure that they can regenerate and have these cells fix themselves before it's too late. Number 4, an injury or a trauma that can cause bleeding of the eye. This is not a good sign. If you're getting into some type of sport, you're getting a trauma every time you have bleeding in your eyes, this is not something healthy at all. As a matter of fact, there could be a detachment of your retina. The retina is the back part of your eye, that if you receive a trauma, maybe a punch, maybe you're boxing, maybe you're playing basketball or even baseball, and you receive a ball in your head, a very strong hit, well, this can rupture these veins, this can rupture these arteries, but it can also detach the retina. People go blind by having this experience, and not only by seeing blood in their eyes, which is the least they have to worry about. The reality is they could go blind with just that trauma or that injury that they are suffering. You have to remember that a bunch, a scratch, or a foreign object in your eye can cause a small vessel to rupture, resulting in blood in your eye. Not a good business, sometimes not even a good sport if this is something that is going on over and over again. You will go blind at some point. And the reality is that the only vessels that are going to rupture may not only be in your eye, they also might be inside your brain, and this you are not seeing at all. If you need something natural that can help you rest well, help you relax, help you take away that stress, make sure that you can stay healthy within circulation in the eye and every single part of your body to be able to regenerate, look for melatonin, 5-HTP, and at the same time Visofar and Appleizer from Fineland at finelandvitamins.com. Don't forget to give this video a like button, don't forget to share, and I'll see you in the next video. Take care.